Risk of miscarriage. 4 signs you can't ignore. The medical term for miscarriage is spontaneous abortion. It is one of the most common complications associated with early pregnancy. Pregnancy is a wonderful time for a woman, but without knowing it may end in a miscarriage. Hence, it would be beneficial to know about the signs and symptoms that may lead to a miscarriage to be safe. Some of the symptoms that can indicate a miscarriage are mentioned as follows. 1. Pain. If you experience severe and intolerable pain in your belly, it would be a warning sign of a miscarriage. If you also have cramps that lead to blood discharge, it can be one of the many symptoms. Miscarriages tend to cause intense cramps, which are similar to menstrual cramps, but much higher in intensity. 2. Bleeding. Bleeding is another common sign of a miscarriage. The blood discharge will be light brown or bright red, and you may bleed heavier than usual. If you bleed during pregnancy, consult a doctor immediately. Bleeding in the first trimester of pregnancy is quite common. A few blood spots on your underwear won't be a problem. However, if these light spots change to something like a regular period, you should consult a doctor soon. 3. Ectopic pregnancy. An ectopic pregnancy is a type of pregnancy when the fetus develops outside the inner lining of the uterus. The signs and symptoms of an ectopic pregnancy are very similar to that of miscarriage, with a few more. Some of the symptoms of ectopic pregnancy are shoulder tip pain, dizziness, diarrhea, etc. If you experience any of these symptoms, it is ideal to exercise caution and visit your doctor to avoid any further complications. Symptoms of pregnancy do not persist if a woman is about to miscarry. The common signs and symptoms of pregnancy, like morning sickness, mood swings, and tender breasts, would no longer be there. 4. Weight loss. If a pregnant woman has suddenly lost weight, it might be an indicator of pregnancy loss. Sometimes some women do not experience any symptoms at all, and they only come to know about the same when they go for their regular ultrasound scan. However, this is followed by the usual symptoms of bleeding and cramping. In such a case, the embryo dies, but is not expelled out. Symptoms mentioned here are signs of a miscarriage. However, not always would they lead to a miscarriage. Seek medical help and get a proper checkup to be sure. How is a miscarriage diagnosed? If you're experiencing any of the above symptoms, call your practitioner. He or she will evaluate the bleeding and then possibly measure your HCG, hormone levels, check whether your cervix is open. It should be closed during pregnancy. Perform an ultrasound to look for a healthy gestational sac and placenta, and listen for a fetal heartbeat. The results of these tests will help your healthcare provider determine whether you've miscarried. In rare cases, miscarriages can be misdiagnosed. If you're bleeding and your practitioner can't find a fetal heartbeat, which can sometimes be tricky even in a healthy pregnancy, there's a slight possibility that he or she might diagnose a miscarriage when an embryo is still thriving. If you stop bleeding, however, and continue to have pregnancy symptoms, a second ultrasound, where the heartbeat is hopefully heard. Even though miscarriages are common in every population of women around the globe, there are some factors that can increase your risk. 2. Age. Studies have found that older moms are more likely to have miscarriages, most likely because their eggs and their partner's sperm are more likely to have abnormal chromosomes. About 1 in 3 pregnancies after the age of 40 ends in miscarriage. 3. Vitamin levels. Researchers have found that deficiencies in vitamin D and vitamin B12 can increase a woman's risk of miscarrying. Other vitamins, like vitamin A, have the opposite pattern. High levels can be dangerous during pregnancy. Taking a prenatal vitamin and getting your vitamin levels tested by your doctor can help lessen these risks. Note that outside of prenatal vitamins, most studies have not shown that vitamin supplements impact the odds of miscarriage at all. 4. Untreated thyroid imbalances. Thyroid hormones affect the whole body and can alter levels of other hormones, including those that play a role in pregnancy. Both hypothyroidism and hyperthyroidism have been linked with miscarriage risks. Most healthcare providers test a woman's thyroid levels throughout pregnancy, especially if she's been diagnosed with thyroid problems in the past. 5. Being overweight or underweight. Obese women, or those with a BMI of 30 or higher, have a significantly higher risk of miscarrying. Likewise, women with a BMI under 18 are more likely to miscarry. 6. Smoking or alcohol use. Both current and former smokers have an increased miscarriage risk compared with people who have never smoked. Studies have also shown that high levels of alcohol intake around the time of conception by both mom and dad can boost the chances of a miscarriage. If you're pregnant or trying to get pregnant, it's a great time to quit smoking and cut back on drinking alcohol. 7. Certain STI. Sexually transmitted infections, including syphilis and some forms of viral hepatitis, can make a woman more prone to having a miscarriage. 8. Large uterine fibroids. These benign tumors, which are extremely common in women as they age, can cause pregnancy complications, including an increased miscarriage risk if they're particularly large in particular areas of the uterus, or if they start to grow in response to pregnancy hormones. 9. Chronic diseases. Pregnant women with kidney disease, autoimmune diseases, polycystic ovary syndrome, PCOS, and diabetes are at higher than usual risk of miscarrying. If you have one of these conditions, your pregnancy may be classified as high risk, and you'll have more appointments and monitoring than other women to help manage your disease and keep your growing baby safe. 10. Medications. Doctors recommend that pregnant women avoid a number of over-the-counter medications, including common painkillers during pregnancy. Many of these cause birth defects, but some also have been linked to miscarriages. 11. Environmental toxins and hazards. Exposure to lead, mercury, organic solvents, and ionizing radiation has been found to increase the risk of miscarrying. These toxins likely aren't found in your home, but are sometimes present in the workplaces of farming or industrial manufacturing facilities. Although the levels required to affect pregnancy would most likely cause you to experience adverse noticeable side effects as well. If you're concerned about your exposure, talk to your doctor. 12. Spacing between pregnancies. Getting pregnant again less than 6 months after your last full-term pregnancy might boost your miscarriage risk just a little bit, although the evidence is mixed. Since this short spacing between pregnancies can lead to other complications, including preterm birth, it's best to give your uterus a longer time to recover. Keep in mind, of course, that most of these risk factors lead to only very slight increases in miscarriage risk. A single glass of wine before you know you're pregnant or missing your prenatal vitamins for a few days is not something to be concerned about. And many women with none of these risk factors still have miscarriages. Remember, too, that lots of rumored risk factors aren't really linked to your chances of having a miscarriage at all. For example, if your mom had a miscarriage or two, that doesn't make you more likely to have one as well.